Theatre 3 is a state-of-the-art orthopaedic and general operating theatre with cutting-edge clean room technology and designated space for robotics. The theatre is fully integrated with the best available equipment. The risks of infection during surgery are further minimised, ensuring improved clinical outcomes.
I'd always wanted to go into medicine. I have no idea why, and I never had a plan B. And once I got into medicine, I always wanted to do surgery. My first surgical job was orthopaedics, and then I was hooked from that moment on. I went to Sheffield University. I then sort of slowly worked my way down the country, so I was a registrar in Oxford. I came to Australia, so I was a joint replacement and revision arthroplasty fellow at the Queen Elizabeth Hospital in 2004. And then I went back to the UK and ended up in London for 10 years, doing a mixture of joint replacement surgery and complex pelvic trauma. And then 8 years ago now, a job opportunity came up back in Adelaide at the Royal Adelaide Hospital doing pelvic and acetabular trauma. If you go back in time 10, 15 years ago, if you went to your doctor and you had a knee arthritis or hip arthritis, you would see an orthopaedic surgeon and they would do one operation. Nothing else in life do you have one solution for everybody. So one of the things that's changed is technology is advanced. And technology from an implant point of view, so you can choose, do you do part of a joint, do you do the whole joint, do you do different bearings, do you do a patient-specific joint replacement, but also the planning. In days gone by, we would have an X-ray, you put an X-ray up and you'd sort of say, right, I'm going to put it there. Whereas now we use CT, we use MRI, we use dynamic imaging, we take X-rays of patients standing, sitting, lying down, getting out of a chair. And this allows you to plan not only what type of implant, but where to put it and how to put it there so that you get a very personal solution for that patient. So here at Western, we've got robotic technology, we use navigation here, we use 3D printed technology, and it's all about getting that perfect solution for that patient, which will be different to the next patient, which will be different to the last patient. Replacing their joint with the best solution for them that then allows them to get the easiest recovery and the best long-term outcome. I do the whole gamut of hip and knee surgery. That includes hip arthroscopy as well as knee arthroscopy and joint replacements of the hip and knee. I very much believe that patients are individuals and every patient is different, and it's about spending time with patients to decide with them what their goals are, what the best solution is, because it's not always a joint replacement, and quite often it's about talking to patients and saying, well, yes, you have this problem, you have arthritis, but actually we can manage that without an operation until such time as they need surgery later on, and giving them a solution that best fits them. And then they typically get better, and you can track them over the next 3 to 6 months, and you have a start point and an end point, and you see them change their life really quite rapidly, and it's very rewarding.
To find out more about Associate Professor Mark Rickman, contact Western Hospital at 08 8159 1200.